Hello, my name is Dr. Leonard Hess, and I'm a faculty member of the Dawson Academy. Today, I'd like to spend a few minutes with you discussing the complete examination. Let's start by answering a couple common questions. The first one would be, why in the world do I need a complete examination? And the second most common one would be, what in the world is it? Well, let's start by answering, why do I need one? And a great way to approach this question is to think about what most patients expect. Most people want their teeth to last them their entire life, but they never really think about all the different factors that will go into determining whether or not somebody's teeth will last the rest of their life. Let me give you a great analogy. If you were to go into your physician and your blood pressure was high, your cholesterol was high, and your lifestyle was contradictory to a healthy lifestyle, you wouldn't be very happy if your physician went to you and said, listen, as soon as you have your first heart attack, we're going to start to take care of these problems. Of course not. We would be outraged because we expect that our healthcare provider would be helping us to look for signs and symptoms of a larger problem so that we can prevent that problem from occurring. Well, that's the whole basis of a complete examination. A complete examination is looking at all the different components that make up the health of your mouth. You know, your teeth are just one portion of what makes up a healthy oral cavity. Things need to be considered, such as your muscle health, the health of your temporomandibular joint, your periodontal health, and also the health of your teeth. So there's a lot of different factors that go into determining how healthy is your system and what is the likelihood that you're going to have a problem with that system in the future. We're always thinking about the health of your mouth in relation to the rest of your life, not just worrying about how is the health of your mouth going to be in the next few months. We're expecting that your teeth are going to be running a marathon, not just a sprint. Two factors which we'll be considering quite heavily during the complete examination would be bacteria and forces. Now, we're all familiar with bacteria and what the effects of bacteria can be in our mouth. We all know that bacteria cause cavities, and most of us are quite familiar with the fact that bacteria cause periodontal disease, which is the loss of bone structure which supports our teeth. And periodontal disease can lead to loosening teeth and eventually can lead to the loss of your tooth as well. But people are usually unfamiliar with the effects of force in our mouth. Remember that when we chew, our muscles can place a great deal of force onto our teeth. Our teeth need to be in a position and need to be contoured and have the proper shape in order to handle these forces properly. If the forces are being placed on teeth that aren't in a position to handle the forces properly, the long-term effects of that can be quite great. We can experience wear of our teeth, we can experience mobility to our teeth, and we can also have our teeth become pushed or moved into the wrong position. All this over time can cause problems not only to the teeth, but also to muscles and also to the temporomandibular joint. So we'll be paying extra attention to bacteria and force. Let's talk a little bit now about what we can expect during a complete examination. Well, one of the first things that we'll do in a complete examination is talk a little bit about the history of your teeth and also the history of your temporomandibular joint. We'll talk about whether or not you've ever been diagnosed with a joint problem or a jaw problem, if you've ever experienced any trauma to your teeth or to your jaws or to your face, whether or not you have a history of clenching or grinding, do you have headaches, or have you ever had any sudden issues with your joint, such as having your jaw lock open when you tried to bite into a big cheeseburger, things like that. We'll also be looking at how your jaw moves, how far you can open, and how easily you can move your jaw side to side. And we'll also be checking to see what the orthopedic position of your jaw is currently, whether or not you're functioning from what we call centric relation or a fully seated jaw joint, or if you're functioning from a position that's slightly different from that. In addition, we'll be paying special attention to 7 or 8 different muscles which help to coordinate the movement of your jaw during function. We'll be doing what's called muscle palpation. We'll be feeling for areas of inflammation, muscle knotting, tension, and also determining if the size of the muscle seems to be abnormal in relation to what it should be. We may also do what's called Doppler auscultation or use a technology called joint vibration analysis to get a better understanding of the function of your temporomandibular joint. A normal healthy joint will be very quiet because inside your joint there's a substance which is the slipperiest substance in your body. And if the joint and the disc is in its proper position, we won't really hear any noise at all. But if a joint has a disc that's out of position, we'll be able to identify that through the use of the Doppler auscultation or the joint vibration analysis. Many patients have clicking and popping in their joints all the time. They don't need fancy equipment to tell us that. But it's important to note that if you are having issues with your joints, such as clicking or popping, that's not normal and is usually part of a progressive disorder. Of course, your complete examination will also include the parts of an examination that we've become accustomed to over time by visiting our dentist. We'll go tooth by tooth looking for any restorative needs. We'll identify areas that have cavities, areas that have stress fractures or any broken teeth that you may have. You can expect to have a complete periodontal examination going tooth by tooth, looking for bone loss, areas of inflammation in your gum tissue, and any buildup that you may have above or beneath the gum line. You can also expect to have your classical type of radiographs. Bite wings looking for decay or bone loss, a panoramic radiograph looking for any abnormalities in your bone, and it will also give us a view of your temporomandibular joint. And based on the findings of our complete examination in relation to your temporomandibular joint, additional imaging may be necessary, such as a CAT scan or even an MRI. Depending on the results of your complete examination, additional records may be necessary. These would include diagnostic photographs and mounted diagnostic casts, which are impressions of your teeth mounted in a very specific way. These two additional pieces of information will help your dentist to provide a complete diagnosis and to aid in the treatment planning process. The complete examination is the foundation of comprehensive dentistry. It's important to recognize what's going right with your teeth or your joints or your muscles and what is stable. And it is just as equally important to recognize what is unstable and what needs improvement for your long-term health. I hope this helps, and I hope you have a great day. Thank you very much for your time and attention.